Good morning and welcome to our COVID-19 weekly media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with our numbers. We have had, as of yesterday, we've had 11,747 confirmed cases of COVID in Shasta County, including 5 from Sunday and 20 from Monday. We've done a total of 191,583 tests. We have 9 people who are hospitalized, including 4 in the intensive care unit, and our available regional ICU capacity, which includes 11 counties, is 34.6%. We have had 219 Shasta County residents who have died from COVID. With us today, we have Robin Schurig, the Public Health Branch Director for the Health and Human Services Agency. Dr. Karen Ramstrom is the County Health Officer. We have Glenn Hayward from Redding Rancheria, Dean Germano from Shasta Community Health Center, and Robert Folden from Mercy Medical Center, Redding. Thank you everyone for being here. And Robin, would you like to start us out today?
Carrie, good morning. I have the blueprint data and our tier assignment to share. Last week, our data qualified us for the orange tier, but we needed to meet those qualifications for 2 weeks in a row in order to move tiers. And this week, our data no longer qualifies us for the orange tier, so we'll be staying in the red for now. Our latest case rate is 6.8 daily cases per 100,000 population. That's up from 5.8 last week. Our test positivity is currently at 3.1%. That's up from 2.4% last week, but still pretty low. Our case rate needs to be less than 6 to qualify for the orange tier, and our test positivity needs to stay at or below 8%. We are now one of 17 counties remaining in the red. There are none in the purple, 38 in the orange, and 3 in the yellow. Dr. Ramstrom is going to share an update on vaccination, and I believe she's also going to speak about the variants that have been identified in our community. So I just want to emphasize the importance of getting vaccinated so that these variants don't have the opportunity to take hold in our community, and also the importance of continuing to mask and distance, as well as stay home if you're sick and get tested if you're sick or have been exposed to someone with COVID, or if you interact with other people on a regular basis. That's all I have this morning, and I'll turn it over to Dr. Ramstrom.
Good morning, everybody. I apologize for the lawnmower outside. He seems to be enjoying driving that thing around out there. So I want to provide an update first on vaccinations this morning. I think everybody's aware that groups that are eligible and able to come and get vaccinated now include individuals 16 and older. We have plenty of supply and appointments available in Shasta County. We wanted to let you know that the MyTurn website now lists appointments for a variety of clinics, including public health, Shasta Community Health Center. When there's MassVax clinics scheduled, you'll see those there as well. And you can also see the links to the local pharmacies that have vaccination appointments available. So please check out MyTurn if you're looking for an appointment. In terms of vaccine uptake, unfortunately, interest in vaccinations has plateaued. Shasta County is among the counties with the lowest vaccination rate statewide. We're at 30% of our population 16 and older receiving at least 1 dose of vaccine. Only 3 other California counties have lower vaccination rates. 2 of them are at 29% compared to us at 30%. And so we're pretty low in comparison. This low vaccination uptake is very concerning, as Robin had mentioned. Concerns about the emerging variants and concerns that this could actually result in an uptick in our cases. We want to avoid a surge or an impact on our hospitals as we have seen in the fall and the winter. These variant strains, I'm going to talk a little bit more detail about in a moment. They're more infectious, they're more transmissible, they can be harder to treat, and they're more likely to be associated with vaccine breakthrough. So I'm going to share a little bit more details in a moment on that. In terms of the decreased interest in vaccination, this is being seen in other parts of the state as well. We have a team of staff that are working to address vaccine hesitancy. We're collaborating with community partners and individuals to address questions and concerns that they have. It's understandable people have questions and they're trying to get their questions and concerns clarified before seeking vaccinations. We're working with these partners to also share testimonials and talk about their experience with COVID-19 and with getting vaccinated. We encourage people, as we've said before, to talk with family, friends, other trusted individuals that you often speak with when you're trying to make some important decisions in your life, whoever that might might be. In terms of outbreaks and variant strains, we continue to experience COVID-19 outbreaks in a variety of settings across the county. To monitor for emerging variant strains and inform our containment efforts, we're partnering with the California Department of Public Health to submit specimens to them for whole genome sequencing. We're particularly focusing on whole genome sequencing testing for cases associated with outbreaks, for people who have severe illness, and for cases and outbreaks that are happening in any of our congregate settings, such as our long-term care facilities. To date, we have results back on 18 specimens that we've sent for whole genome sequencing, of which 11 are positive for variants of concern. We're waiting on an additional little over 100 specimens to come back with results. Of the 11 positives so far, we've identified 2 cases of the B117, or it's also known as the UK strain, 3 cases of the B1427 or B1429. Those are known as the West Coast variant, and those are the predominant strain in California. About between 50 and 60% of cases of COVID-19 specimens are from the West Coast variant. And just recently, we've identified 6 cases of the B1351, also known as the South Africa variant. All of these 6 cases are connected and have resulted in 4 deaths, plus 3 hospitalizations. The outbreak involved a long-term care facility, as well as individuals outside of the facility, and included partially vaccinated residents in this facility. All of the 4 variant types are more contagious than the original COVID-19 virus. The South African and West Coast variants may also impact how well the monoclonal antibody treatments work and vaccine effectiveness. The B1351 South African variant is one of the least common variants. It makes up about 0.7% of the variant cases circulating in the United States and 0.3% in California. That's according to the CDC. The variant strains are monitored at a national level to see where they're circulating. Our low vaccination rates in combination with the emergence of this strain locally is very concerning and really requires prompt attention to increasing our vaccination coverage to prevent these variant strains from taking hold. In terms of vaccine breakthrough, we expect that, the vaccine is not 100%, so we expect to have some cases among fully vaccinated individuals, but we are closely monitoring the vaccination history of newly confirmed cases, particularly with the variants in mind. To date, we've identified 23 new COVID-19 cases that meet the criteria for being fully vaccinated. 22 of those individuals are connected to 8 separate residential congregate settings. 5 of the 23 potential vaccine breakthroughs were found to be symptomatic. 1 was hospitalized, and there have been no deaths, which is reassuring. We have whole genome sequencing pending on those 23 individuals. Fortunately, vaccine uptake is high among residents in our long-term care facilities across the county, but low vaccination rates in staff can make those residents vulnerable to variant strains coming into the facility. We highly encourage staff of these residential care facilities to get vaccinated, and we know that they are among the general public, right, who have questions and concerns. So we're working with those facilities to identify what those questions and concerns and barriers might be, so we can address those if those staff are interested in getting vaccinated. And lastly, just a brief update on the Johnson & Johnson vaccine pause.
We are ready for media questions, I guess, as ready as we'll ever be.
Well, I've got a question, I guess maybe for Robin, since Dr. Ramstrom isn't there. Do we have any idea on the people who aren't vaccinated, the vaccine hesitant group versus the vaccine refusal group?
That's a good question. We know that there are some members of our community who are just not interested in being vaccinated, and there's no convincing them. And some people, are just have some unanswered questions or some concerns that they need to have addressed first before they make up their minds. But we don't have a good sense of how many fall into each camp.
I have a question also regarding that. You were saying that you're trying to address vaccine hesitant areas of the community, and are you sending people out into certain communities and to speak directly with them in groups, or even going door to door? How are you approaching that? How are you speaking to those vaccine hesitant communities?
Yeah, so part of it is we are doing outreach to specific groups, including geographic areas, and also like racial ethnic groups or different groups like that that we know tend to have more hesitancy and want to hear from, as Karen was saying earlier, somebody who they trust and somebody from their community. So as opposed to just putting messages out on our website, for example, and expecting them to, listen to us and trust us. We're trying to get the messages out to leaders within the community so that they can share that information with their either people they serve, if they are from a nonprofit organization or something like that, or just people they know in the community.
Thank you.
Is there a place on maybe the state website, or is it maybe on the local one that lists all the counties' vaccination rates?
There is a place on the state website that shows that data, and I don't know off the top of my head where that is, but we can find that and send it out to you.
Thank you.
It's very disconcerting to see us already starting to hit a wall with uptake. We certainly been focused on the rush of people, particularly at highest risk, but we keep talking about wanting to open the county and the businesses and all the things we do. We have a tool here, vaccinations, that highly effective, and yet we're sort of we're seeing it drag now, and it's mind-boggling to think that that's the case. We have abundance of vaccine, we have plenty of access to it. We have a need. We have variants out there that could be coming, are in our community already. And, it's more of a speech than anything else. But it seems to me if people really want us to get life back to normal again, this is the best pathway there. And we should take every opportunity as a community to do it. And every convenience is now available to individuals to get their vaccines. Time of day, type of vaccine, J&J. Might be something that needs to be tweaked some when it becomes when that decision's made. But we as medical providers are there to make it happen, and we need the community to embrace it and come forth, and then we can start getting back to normal. And unless we do that, we could be sliding back into purple if we don't. And we know what that looks like. So.
All right. Welcome back, Dr. Ramstrom. I see you employed a new strategy. It looks like the network is completely down on breast here. So
Yep.
We're recording, and then we're going to just post the video once we're done here. Did you have anything else that you wanted to add before we go to the town hall questions?
I don't. Thank you.
All right. We received several questions from the public, and I will ask those from a couple of citizen journalists. Where exactly is HHSA Public Health getting the latest symptom list if injected by Johnson & Johnson, remonitor and track if having reactions of headaches, abdominal pain, leg pain, and shortness of breath? Is the symptom list from manufacturer Johnson & Johnson, the CDC, the FDA? And then also, birth control pills were never on pause or hold, and they have a much higher clotting. This is a little fragmented, and much higher clotting issues. Thus the confusion as to why now for so few.
I can take that, Carrie. So as I mentioned earlier, the vaccine was put on pause by the FDA and CDC out of an abundance of caution because they saw this little uptick and in the VAERS report, 6 cases with the blood clots associated with low platelet counts. And that's the point of having VAERS, is to identify these rare events after, you roll out a vaccine and you're vaccinating larger numbers of population. That's when these things can show up. And so because they were worried about that and wanted to make sure and to investigate whether it's associated with the vaccine, they put it on pause. And when they looked at those 6 cases, those were the symptoms that they identified. And so the CDC and FDA put out that list of symptoms for the public to watch for in case they recently received that vaccine.
Okay, thank you. Here is one more for you, Dr. Ramstrom. What impact on hesitancy or complete avoidance is linked to the latest disaster by harm of side effects by latest mistake of 15 million doses to be destroyed as terrible mix-up of ingredients?
So we don't have a comprehensive assessment of the reasons that people are vaccine hesitant. We do know that from national surveys that people are reassured by the systems that are in place, whether it's by national organization or federal organizations that do oversight of vaccine manufacturing, or these surveillance systems in place, such as VAERS that we talked about before. But we are doing our best to ensure that our residents have access to factual information that will help them to make informed decisions, and providing them with multiple opportunities to get that information and seek vaccination and address any questions or concerns that they've had that we've already spoken about earlier today.
All right, and then this one is, sounds like regarding some of the statement that you shared, Dr. Ramstrom, at the board yesterday and reiterated again today. What precise tactics, re-education, further efforts, pressure, and what some call coercion tactics to submit to the shot while VAERS data keeps reporting adverse reaction, surges, and deaths?
So it's never our intention to coerce anyone into anything. These are, decisions, personal decisions that people need to make. Millions of Americans have been safely vaccinated and are now protected, and we hope that people continue to choose that option. We have a working relationship with the facilities that I was referencing, that we are hoping to see an increase in interest among their staff. They're just like the rest of us, and they have questions, and so we're surveying them as we continue to have ongoing conversations and interactions with them, and trying to identify what questions, concerns, issues that their staff might have, so we can support the leadership in those facilities to address those concerns that their staff might have and encourage them to get vaccinated.
All right, thank you. We were also asked to re-ask several questions that were directed to Dr. Ramstrom last week, but were answered by our Deputy Health Officer, Dr. Vivakis, in her absence. And Dr. Ramstrom supports the answers provided by Dr. Vivakis, who was speaking on behalf of our agency last week. We also received a question about a volcanic eruption on St. Vincent Island and human rights, and we are unable to address these questions. This person also asked if it is okay with us locally to withhold goods and services from those who choose not to take the COVID-19 vaccine, and that is not happening here, nor have we made any such recommendation. People are not required to take the vaccine, although science shows that it is the best way to protect a population against COVID. Are there any other media questions? Okay, I also wanted to share with all of you that this is going to be, today is our last online media briefing in this format. These weekly briefings began as a daily in-person press conference early last year, so the media could get their questions answered efficiently by our very busy public health director, health officer, and healthcare partners. We were getting dozens of questions from the media every single day, and so this was a great way to collect all the questions and all the experts in one spot. We began live streaming these briefings so the public could hear everything that our experts were saying, and we do want to continue to provide useful, timely information to the media and the public regarding COVID-19. Things are not changing as rapidly any longer, and interest in the briefings has waned, so we will continue to provide updates at 11 a.m. Wednesdays, just like everyone is accustomed to hearing through a short pre-recorded video. We would be happy to include any updates that our healthcare providers might have. We may also bring other experts on board to answer questions as needed for various topics. And we're going to post those to our website and social media at 11 a.m. on Wednesdays. We'll continue to answer local media questions, as we always do through the Public Information Office. And if there is ever a need for a media briefing, just like with any other topic, we would send out a news advisory invitation as we did before the pandemic. We'll also continue to respond to public questions that come to us through email at covid19@co.shasta.ca.us or through our Facebook Messenger. Thank you, everyone, for another media briefing. We apologize for the technical difficulties. We will have this version of the video captioned, and we'll post it on our website and social media. So anybody who missed this last half of it can access that information just a little bit later today. Thanks, everyone, and have a safe and healthy day.
Thank you. Love you all.
Thank you. Thank you so much for doing this every week. We really appreciate it.
Thank you, Jessica and Mike.
I can't guarantee there won't be still emails, but you know what? We really
Oh, by all
appreciate it.
means, that's what we're here for. I would be sad and bored if I didn't have questions from all of you.
Thank you again to everyone.
Take care, everybody.